Okay, Schistosoma haematobium. Schistosoma haematobium is different from Manzoni in that it causes urinary bilharzia. The other one was causing intestinal bilharzia. So where is this one found? It is found in the veins, vein plexuses, specifically the vesical and pelvic plexuses, like the ones that supply, that get blood from the urinary tract. The adult worm can live up to 30 years, 20 to 30 years. So it's really can stay. When you look at the morphology, again, the male is smaller than the female. Okay. When you look at the male, it has got a gynecophoric groove where the female is held, like this groove where you're going to find the male. Basically, that's how most of them are, the cystosomes. But different for Manson, remember it was only laying about 1 to 3 eggs. It only had about 1 to 3 eggs in your uterus, but hematobium has got about 20 to 30 eggs in its uterus at one time, and it can pass up to 300 eggs in a day. And when you look at the egg for Schistosoma haematobium, it has got a terminal spine. Mansoni had a lateral spine. Okay. So what you are going to say, sometimes in mesenteric portal system, pulmonary arterial, and other ectopic sites, you can find these eggs. Normally, they're supposed to be found in the plexus or veins that are found related to the pelvic region where you have got the urinary tract, like the vesicle and pelvic plexus. But sometimes you can find them in other regions. So the eggs will pass into the bladder, assisted by piercing action of spine, this terminal spine, and the lytic substance which is released by the egg. So that's how they end up going to the bladder. So the eggs will be laid in ectopic site, generally die. So if the eggs are found in another area other than these vesicle and pelvic plexus, they would end up dying. Okay, and once they die, they are going to cause a local tissue reaction there. So the eggs can as well be found in rectal biopsy, but are rarely passed live in feces. So the life cycle of Schistosoma haematobium has got two hosts. The definitive host is human, which is the only human and natural definitive host. There is no animal reservoir. Intermediate host is a freshwater snail. But look at this. You can see that the genus is different from that of Manson. This is the genus is Bulinus globosus. The infective form is still the Secaria. So it's only the genus that is changing for these different types of cystosomes. And when you look at the life cycle, what is going to happen is that the eggs with the terminal spine are passed in urine. And then they'll go, once they reach fresh water bodies, they'll hatch into the Meracicardia. Meracicardia is now going to enter the snail, which is of the Bulinus genus. Okay, and then the Miracicardia is going to, of course, it will swim in water and penetrate into the snail. Once inside the snail, it will develop into the sporocyst. The sporocyst will divide. There's the first generation sporocyst, second generation sporocyst. They will now produce Secaria. That takes about 4 to 8 weeks, like 1 month to 2 months. The Secaria will now be able to move out of the snail in about 1 to 3 days and penetrate human skin, and there it will now be able to transport in the human being, transform into the cystosomula, and then it will go to the liver and then mature into the adult worm. The adult worms, remember again, they will pair and then start releasing eggs. So while in the man, the Secaria will shed off its tail and then become the cystosomula, which will enter the peripheral venules, and this guy will enter and grow in the intrahepatic portal veins, the veins that are found in the liver, and become differentiated. And then they'll migrate to the vesical and pelvic venous plexuses where they mature into adult worms and then start laying eggs. So this will just represent the life cycle that we've already talked about. So how does evasion of a host immune system happen? So how these worms manage to enter the human body is that they avoid recognition by the antibodies. Like they basically hide from the antibodies. And then there's also the antigenic masking with self antigens. So they actually hide themselves. Okay. So cystosomal acquire host antigen. Like they end up getting the same antigens that we have. Antigens are basically proteins. The same proteins that we have, they end up getting them. And the body can't attack itself. So because the body will start thinking, okay, this is self, it can't attack. So the pathogenesis, genesis and clinical findings again is based on three stages: skin penetration, egg deposition, and tissue proliferation. When it comes to skin penetration, what is going to happen is that it begins when the Secaria penetrates the intact skin. Okay, when you come in contact fresh water like from the river, from the lakes, the Secaria will shed off their tails and then will become the cytosomal, enter peripheral circulation, and then we'll go to the lungs, back to the heart, to the liver sinusoids, which are the veins, and then mature in about 2 to 6 weeks. And then at the point where it was entering the body, it can as well cause a swimmer's itch, okay, and then, which is a pruritic rash, and then a low-grade fever, and it can remain asymptomatic in this stage. This is actually the incubation phase. Incubation phase is the period between the entry of the parasite and the showing off of symptoms. Okay, here the pathology hasn't yet set in. Secaria dermatitis happens at this point. Secaria dermatitis, also known as general anaphylactic or toxic symptoms, is basically the same what we are calling a swimmer's itch. Okay, there is dermatitis. There is going to be inflammation of the skin, so you see the redness. So it's particularly severe when infection is due to Secaria of non-human cystosomes. So this dermatitis is much more severe when Secaria of non-human cystosomes. We have got different types of cystosomes, even those that don't cause infection to human. So especially those are the ones that will cause even worse dermatitis. Anaphylactic or toxic symptoms include, so if there are these toxins being released, okay, or the body is trying to react, really not toxins, but the body is trying to react to the entry of the worm, there's going to be fever, headache, malaise, urticaria, accompanied by increase in white blood cells. There's going to be eosinophilia, enlarged tender liver, and palpable spleen. So there is a splenomegaly. This condition is more common in infection with Schistosoma japonicum, and it's known as Katayama fever. We also discussed Katayama fever in the previous uh, discussion with Schistosoma mansoni. So when the eggs have been deposited, mature, they will mature into adults, and then they also start laying eggs. Okay, and these eggs will be deposited into the bladder. Some eggs are going to be successively removed via the urine, while others are going to be trapped. Those that are trapped or by extrusion, as the eggs are moving out, they can cause pain during urination, dysuria. Also painful terminal immaterial, like when you are urinating, but the urine that remains at the end, as you are removing the urine at the end, it now causes you get to remove some blood. So pain, this is actually painless. Okay, so blood at the end of urination, but sometimes can become gross, like you are just removing blood every time. And then there'll be also frequency and agency, like you are urinating too much and then there's this agency to urinate, you just want to urinate. And most patients develop frequency of urination and burning sensation. When someone is urinating, they feel like there's burning. Okay, and the area of hyperplasia and inflammation of bladder mucosa are seen on site cystoscopy. So you can see inflammation and hyperplasia, because what happens that the bladder will start changing, the epithelium is now proliferating. So the trapped eggs can trigger granulomatous inflammation, and that can create fibrotic nodules and ulceration in the blood. And then there's also the phase of tissue proliferation and repair. So chronic phase is dominated by immune mediated granulomas, fibrosis, and calcification. So long-term tissue remodeling can happen, because remember what happens that when the worms have gone to the blood, there is this destruction that is happening because the body is trying to produce really producing these white blood cells to come and attack the worm because of the antigens. Okay, so after that happens, the body will also be trying to remodel to mm, better itself. Okay, so they can be obstructive uropathy. They can actually be this obstruction that can be created ureteric strictures, because once destruction has happened and then healing is trying to happen, strictures can end up forming. For example, if someone bends themselves, they can remain, like, especially if there is a bending that happens somewhere on the joint, you can even be failing to extend those joints because of the strictures. Okay, so they can be ureteric strictures that can cause obstructions and hydronephrosis, water in the kidney. They can also be pseudotumors. These are false tumors, false cancers, generalized hyperplasia and fibrosis of bladder mucosa with granuloma appearance. That's known as the sandy patch. Granular appearance, not granuloma. And then they can also be squamous cell carcinoma of the bladder. Okay, recognize WHO group 1 carcinogen. So actually, Schistosoma haematobium is a cancer, is a carcinogen, is a guy that has got potential to cause a cancer. Squamous cell carcinoma of the bladder, it's recognized as a carcinogen. Carcinogen are substances that can cause cancer. So what happens is that when there's ectopic migration of these eggs, they can result into, on the genital tract, they can cause infertility and ectopic pregnancy. And on the spinal cord, they can cause transverse myelitis, the inflammation, and of course that can result in paralysis. And to the lungs, they can cause pulmonary hypertension. And if there's pulmonary hypertension, they can be heart failure. So that is copulmonary. Actually, copulmonary is heart failure because of a pulmonary cause. Okay, so that is what can happen. So diagnosis of Schistosoma haematobium, you can do urine microscopy, which is the gold standard. The eggs are going to be seen, which are non-opaculated and they have got a terminal spine, and they are best collected between 10 a.m. and 2 p.m. when the egg excretion is highest. So from 10 hours to 14 hours. Okay. So occasionally the eggs can also be seen in feces. You can also do an egg viability test. So mix urine with distilled water and then observe for miracidia hatching. Because remember we said that the miracidia only comes out when there's contact with fresh water. So this is the egg viability test. And then bladder or ureter biopsy may reveal eggs in tissue. You can also do ultrasound to detect bladder wall thickening, and this is used for staging chronic disease. Also, X-ray can as well be done, especially with ureteric obstructions and pseudotumors. You can also do blood tests like antibody detection, like ELISA, and antigen tests like CAA and CCA. For the treatment of Schistosoma haematobium, again, you can use Prasquanto, which is the drug of choice. Also, mitrifonate, which is the alternative drug for hematobium. In secondary, if there is a secondary bacterial infection, like someone has got these worms, because the immune system becomes weak, they end up having bacteria coming in, you can also give antibiotics. Okay, if there is a cancer, surgical intervention can be indicated in that case.